Hi there. I would like to discuss Miss S in Clinic Room 1 with you if you have a moment. She is a 22-year-old Caucasian female who voices she is in good health, currently concerned regarding a 4-day history of a sore throat. She reported here urgently this morning and voiced she thinks she may have strep throat, as she had a similar presentation about 3 years ago for which she was diagnosed with strep throat and required antibiotics for treatment. She states she was feeling well until awakening in the morning, 9 a.m., 4 days ago, with pain in her throat, feeling tired and generally unwell. She describes the pain as a constant 5 out of 10 sharp pain that had a sudden onset to her posterior pharynx. She has had decreased oral intake related to painful swallowing, but did voice that cold liquids and popsicles provided some relief to her. Approximately 3 days ago, 20 to 24 hours after the initial onset of the sore throat, she did become febrile and reported chills as well. She did an oral temperature check at home, which reached a maximum of 38.5 degrees Celsius, which occurred 4 hours prior to this clinic visit. At that time, she took acetaminophen, 1,000 milligrams, PO, and she was afebrile at 37.6 on arrival to the clinic today. She denies any known COVID-19 exposure or recent travel history, but she did voice that her roommate had recently had a sore throat approximately 1 week ago. This is her first time seeking any medical attention in regards to this concern. She denies any nasal congestion, rhinorrhea, cough, shortness of breath, or recent viral illness. She denies any nausea, vomiting, diarrhea, or abdominal pain as well. She does voice that her neck is quite tender when she touches it. Miss S denies any allergies or pertinent prescription medications, and I did check EMR and confirmed this as well. In regards to her history, she had an episode of Group A streptococcal pharyngitis 3 years ago. She reports that they collected a swab of her throat to diagnose her at that time and was then prescribed penicillin. She confirms that she completed the total prescribed amount of penicillin in full. She has never had scarlet or rheumatic fever. All her immunizations are up to date, and she has already received this year's influenza vaccine. She reports a healthy relationship with her boyfriend of 2 years and states that this is her only sexual partner. She's currently attending university in the city and lives with a good friend. She occasionally drinks alcohol, approximately 3 to 4 beer, 2 to 3 times a month, denies any recreational or illicit drug use, and voices that she did vape for a 4-month period approximately 2 years ago, but she has quit, and denies ever smoking traditional cigarettes. So I completed a physical assessment on her and found that she looks well, she's calm, non-toxic looking, no signs of respiratory distress were noted. She spoke in a normal volume and tone, and there was no hoarseness noted to her voice. I did happen to notice she would grimace every time that she did swallow. Her vital signs were unremarkable, and she's currently afebrile. There was no presence of a maculopapular rash. She doesn't have any sinus tenderness on palpation. Her tympanic membrane and ear canals were normal. No otorrhea, edema, or erythema were present. Her lips were dry, cracked, and pink, but her oral mucosa and tongue were moist. No rhinitis was noted. I did notice on examination of her oral canal that she did have petechia to her hard palate, with 3+ tonsillar hypertrophy, erythema, and white exudates present as well. Examination of her neck revealed a midline trachea, a non-palpable thyroid gland, and 2 soft, tender, mobile nodes in her right anterior cervical chain that both measured approximately 1 centimeter by 1 centimeter each. She has clear and equal air entry to bilateral lungs. She is free from any increased work of breathing or accessory muscle use. Her chest expansion was symmetric as well. Her abdominal exam revealed a soft, flat, non-distended, non-tender abdomen with non-palpable spleen and liver. I did complete the modified center score as well and noted that she scored a 4 on that. So overall, based on her history of a sudden onset of a sore throat without a cough, presence of a fever, and her physical exam findings of her tonsillar hypertrophy, erythema, and the weight exudates that's present with the petechiae on her hard palate, in combination with the center score, I think she has pharyngitis, and it is likely group A streptococcal infection causing this pharyngitis. As she doesn't have any new rashes and her abdominal exam was unremarkable for splenomegaly or hepatomegaly, I think that infectious mononucleosis is low on the differential diagnosis list, but I would like to complete a rapid antigen swab for group A streptococci, and then together we can discuss this further to create a plan and decide if any other investigations are needed.